So we don't recommend too many products here at Dynamic Chiropractic Clinic, but one of the few that we do is this pillow. It's called the Therapeutic Pillow. It's the only one I've really ever sold. The reason I like it is for a number of reasons. It's sprayed into a mold, and so when you spray these into the mold, it develops a skin, and the skin disallows dust mites from getting into the pillow, and so it stays hypoallergenic through the length of its lifetime. The other thing I like about it is that it's actually foam. It's not Tempur-Pedic foam where it gives way and contracts to what you've got. That would be an accommodative orthotic for the neck. I like this because it approximates a corrective orthotic for the neck, that the more pressure I put on here, the more it pushes back at me. That's necessary to evoke a change. I also like the shape of the pillow in that it forces a curve into the neck while you're laying on your back, or what we call a supine position.
Can we get a side view of that?
Sure, I'll put it in all three dimensions there. Is that better? Somehow?
There you go.
Okay. So when you lay on your side, the pillows are gradiated for the distance between your shoulder and your head, so that when you're laying on your side, it doesn't allow you to tilt up or down when you're on the pillow. So each person gets a pillow that really does kind of sit well with them. So what we'll do is we'll have this young man lay down on top of this pillow and we'll describe it to you. Go for it, young man. So you'll find that you'll get on here and this will orient you as to where you need to be in the pillow. It's pretty comfortable, isn't it?
It is, very comfortable.
It's more comfortable than you thought it'd be, I know.
It is.
And so what happens is it supports the upper thoracic spine here, forces a curve into the neck, and allows the head to rest in this nice, calm, latex-filled sides. Can't tell you. So when you lay on your side, I'll have you go ahead and do that. Go ahead and lay on your side for us. And lay here. Now this is probably a little low for us, but we'd like to see the nose be straight away with the ground. If the pillow's a little bit higher, it'll support him up here. If it's a little bit lower here, obviously it brings them down. We assume that people are going to sink into their mattress a little more than what we would here, and so we often recommend a size smaller than what we would expect for anyone else. So I'm 6 foot, I sleep on a petite. I think this is actually a child size, and you would be on the verge of that. So we don't attach any qualification to the size. We should just call them really small, medium, large. We don't.
It's comfortable on the side too.
Good. So that's one of the things that we recommend for these patients. Another one that you see us prescribed for our patients are these foam rollers. The foam rollers are used on patients not in the neck at all, but we use these in the upper thoracic spine, which is the area from here to about here. And the reason that we get extension and we use these foam rollers in the thoracic spine is that it helps bring the chest up to the ceiling, really getting that extension that we're looking for. And you'll hear that word extension in our office over and over and over and over again. Extension is one of the key components to you getting rid of the disc injury. It's also a key component to keeping pressure off the spine and rounding us forward. So this is a really cheap and easy way to get that. If I have you turn to the side just a little bit. Essentially what the foam roller does is I'll have a patient lay on it. They'll roll back and forth right down through here, right to around imaginary bra strap would be, and then come right back up to here again. And that extension really, really helps get that upward lift that we're looking for. It really comes back to one thing. We want you to lift your chest bone up to the ceiling. That's the key to all extension. As long as you're here, you'll get the extension that we're looking for. Okay, so if you ever have a question as to what we'd recommend for posture, we want to keep it simple and grab onto that one thing. That one thing is lifting your chest bone up to the ceiling. Now there is one more product I'll have Dr. Lee show you that we use in our office. He's probably better to demonstrate it than I am, so we'll go ahead and end this video and we'll have Dr. Lee take over.